My name is Weatherwoman Lily. You were just shown the weather for the week. Now we go on to an exclusive interview with Liam Langston and his grandmother.
This is my grandma. Introduce yourself.
My name is Kim Schmidt, Liam's grandma. I am in the medical field, and from what I understand, Liam wanted to ask me some questions about my background and what I know about cancer. So I went to school to become an occupational therapist, and I got very interested in anatomy and physiology doing that, and I switched my major to nursing. I've been a nurse for a long time, recently retired. My first job, I worked in orthopedics, and I did take care of some cancer patients there that had different kinds of problems like multiple myeloma. And after that, I became a pediatric nurse, and then I worked in labor and delivery and postpartum, and then I worked in insurance for a while, and then I went to Children's Healthcare of Atlanta, and I was the NICU case manager for almost 20 years, working on discharging babies. And actually, we had some babies that were born with cancer when I worked in that unit. So it's prevalent all the way from the time babies are born to the elderly.
Tell me, how does cancer spread?
If it goes unchecked, if there's a tumor that is not picked up on, it can spread. It can spread very easily in a pH environment that's acidic. So if you have symptoms, you need to make sure you go and get them checked out and not let it go unchecked, because it can spread, depending on how aggressive the tumor is, it can spread pretty quickly. There's definitely a genetic component to cancer as well.
What medications are used to treat cancer, and what are the chemical reactions that happen from that?
I have not done a lot with cancer in my nursing career, but there's two that come to mind right now are Cytoxan and methotrexate. I know that Liam and I were talking about dosing. The normal dosing, I had to look it up for Cytoxan, is an oral dose is 2 milligrams per kilogram daily for 8 to 12 weeks. And if you're giving it IV, it's 40 to 50 milligrams per kilogram intravenously over a period of 2 to 5 days, and that's divided up. So that's pretty much what I know. I don't know a lot about the latest cancer medications. I do know that the treatment of cancer is changing a lot towards more targeted therapy. Immunotherapy causes a lot less side effects because you're just targeting the cancer cells, not the healthy cells around that area that don't need to be poisoned with the chemotherapy treatment.
Right. Well, thank you for your time for the interview. I think this will help explain a lot about cancer and its effects.
Thank you, Liam.